Don't just be honed in on what you experience as a student. And you know, we're talking early 90s, they'd not come across chips and curry sauce yet. The people coming behind us quite quickly were the E2000s who came out with diplomas, and then people came out with advanced diplomas, and then people, so it was to keep up with the nurses coming through behind to a certain extent.
A quick fire round now, 30 seconds, nothing more than that. I'm going to put some statements out there. You can give me your first judgment, your first thoughts on it. Hopefully get a reaction in terms of what your initial thoughts are and how you advise our audience as well. So first one, I hope you don't hit me after this. Lecturers have very easy jobs with long holidays.
We have good holidays, but not any longer than anybody else. And within nursing, ours is a 12-month thing. We don't get breaks like other subjects. Okay. So not in nursing.
So it's not an easy job and you don't have long holidays, okay? Lecturers just read from slides and textbooks and have a very boring profession.
No, because you need to stay updated. We're wanting to educate the next generation in evidence-based practice, so you need to keep up to date with what you're doing. So hopefully don't read just from slides.
You definitely have to have a PhD or a master's degree to be a lecturer.
Absolutely don't need a PhD, certainly not within nursing to do it. No tweed jacket, no patches on your elbow, no.
And every academic job requires research as part of the contract.
No.
No. That's a simple no, guys. So any of you concerned about that, that's definitely not relevant. Hello and welcome to today's Pareto podcast episode. My name is Camille and I'll be the host for today's episode. The Pareto podcast hopes to illuminate different careers within healthcare. We will bring interesting and exciting guests who have had varied careers, introducing academia, private medicine, and different scopes. We will introduce interesting clinicians and people who have led varied careers within healthcare. And hopefully you'll pick up interesting tips and tricks to incorporate into your own career pathway. Joining me today is Liz Mosely, who started her career off as a nurse, transitioned into the role of an ACP, and has also dabbled in the world of academia. So I'd like to say hello and welcome, and hopefully by the end of today's episode, you'll be more informed about how to incorporate academia into your own portfolio as well. Welcome, Liz.
Hello.
So, a quick introduction to yourself. I've made mention that your background is of a nurse. So tell me a little bit more about yourself. If you could have a two-word summary, a brief of your career, that'd be brilliant for our audience.
In 2 words?
In 2 sentences.
I said 2 words for 32 years. An interesting life is probably what I would give my nursing career from start to finish, as it kind of continues now.
So you're still working at the moment?
Yeah, I still work as a university lecturer. I have just retired from clinical practice.
Fine. So, 32 years, as you've just mentioned, that's a long career within the National Health Service. So we'll delve into different aspects of this, and hopefully by the end of this podcast, myself and the audience as well can gather some more insights into what the kind of challenges, what the kind of highlights were within this career as well, and what kind of advice you can give to our audience as well. So you started off your career as a nurse. So take me back to the start. Tell me a little bit about what brought you into nursing and how you came into the NHS via that pathway.
So I started my nursing not long after Florence, so in 1988. I had always wanted to be a nurse. I can't actually ever remember not wanting to be a nurse. I knew exactly what I needed to get into nursing at the time. Obviously in the 80s we were not associated with universities or colleges. You were part of the school. The hospital paid for you to be a student nurse with them. So I am old school of Huddersfield trainee. At the time I qualified in 91, limited jobs in the Yorkshire and Humber area, so I travelled south and I worked at the Royal National Orthopaedic Hospital. Orthopaedics had always been my true passion. I really enjoyed orthopaedics as a student nurse. So I was looking for orthopaedic jobs, and that's how I ended up at Stanmore. Got homesick for Yorkshire.
Of course.
So came back to Yorkshire and started on an orthopaedic rotation is what I started on, where I was supposed to do 6 months male orthopaedics, 6 months female orthopaedics, A&E, and outpatients. Started in outpatients, brilliant. Every weekend off, I scuba dived at the time. Life was going to be great. But they said to me, would I start in A&E? Because they'd overstaffed the outpatients. So I started in A&E. I had hated A&E as a student nurse, and I would say that is one of the things that I would pass on to the students I come across now.
Okay.
Don't just be honed in on what you experience as a student. You really need to see it and experience it. As a student nurse, I vowed I would never set foot back in another A&E department in my life. But actually, it's A&E where I've flourished and had the best career, and I would have ruled it out at the time. So I think one of the first bits of advice would be just try everything, because you never know.
Yeah, absolutely, yeah.
And then I've dabbled in different A&Es. I went back down to Watford, followed my heart, fell in love, got married, had children, came back to Yorkshire, got homesick again, and that's when I ended up in Bradford, and that's where I've spent the last 32 years.
Okay, brilliant. So that just summarizes quite a long, illustrious career and many ups, hopefully, and the occasional downs as well. That's of anyone's career. So you mentioned a couple of points there that I'd like to touch on, if that's okay. I think the first point is in terms of jobs. So you mentioned there straight away, and that sort of got my attention in terms of originally when you qualified, the job situation was difficult. You weren't able to get the start you were hoping for. Many people think of nursing as a profession where, because it's so vocational and linked to a particular profession, that you just pretty much start on your feet. There are some parallels to that, to today's workforce, especially with nursing in mind. So tell me about that experience and how you sort of managed that, because perhaps you had your heart set on a job and you were expecting to actually get a job on qualification.
Yes, I was hoping to stay in the Yorkshire area. I'm a Bradford lass, I'm a Yorkshire lass. I love Yorkshire, and it drove me south. So it drove me to North London, which was well out of my comfort zone, going so far away from parents and home. But actually, that then probably changed how I then progressed my career, because it gave me a different confidence. So even in things where there's a bit of adversity, actually it gives you another channel, it gives you something else, it gives you a drive to do something slightly different. And that's what it did for me. It sent me down the M1.
Well, the M1 has that silver lining there. I'm sure people have had the opposite experience where they've come from the south to the north, and each population type, the style of living, I suppose the kind of lifestyle that you enjoy in different areas of the world is perhaps opens your eyes when you didn't get that first choice in Yorkshire. So tell me, so you were in London for the first time. What challenges did that bring as someone who's not from the area as such, in terms of sort of setting up life there and trying to progress a career?
So, it's down to, these tubes. And, we're talking early 90s, they'd not come across chips and curry sauce yet. It was a whole new thing that we needed to enlighten some of the fish and chip shops nearby. It was just that different kind of aspect. The beer was flatter, there was just the varying things. I did hone around other northerners. There was a girl from Cumbria, somebody from Scotland, and we kind of made our own little bubble to survive. The South, they were really friendly, they were really lovely. It gave us another aspect to look for, but initially it was just very different.
So the reason why I pull parallels from today, currently where we are sitting now in March 2025, there are a lot of issues around recruitment. Without getting into the politics of things, would you see for going forward, we're having challenges with nursing staff, getting jobs out of qualification, doctors, GPs, etc. But, what kind of advice would you give to our audience?
It will improve. The NHS is a very large merry-go-round, and eventually it will come round. Like I said, any kind of adversity can often give you some positive. It will give you a different look. I would stay positive. It can feel really hard at the time. It may send you to areas that you don't want to be, but actually you don't know what may come out of that. And so there can be positives. It feels hard at the time, but actually on the other side there's great things to be had.
Absolutely. So I think that's really insightful in terms of a person who's perhaps not got their first choice, not got what exact job role they were hoping for, to perhaps explore alternatives, and that way they can keep progressing their career. And so one important aspect that I took out from your CV, which I've got in front of me, is in terms of you've managed to then progress in terms of nursing up to sort of higher roles in terms of perhaps that was incorporating some management and furthering your training as well. So do you want to talk a little bit about that in terms of why you chose to do that first of all, and what were the opportunities afforded to you to do so?
So yeah, so kind of where I came from when I qualified, we only came out with a certificate. So I was no diplomas, no degrees. So I've had to go on then and do my diploma, my degree and my master's, all while still kind of working full time. But what it did was I ended up in A&E, and within A&E I was encouraged with other courses. I actually always thought I would end up back in orthopaedics. So we used to have an English National Board certificate, and I did orthopaedics. Everybody else I worked with was doing A&E. I kind of anyway, 32 years later it never changed. But we were encouraged to do courses, we were encouraged it. I can remember when my nurse lecturer saying to me that nursing is very much ongoing learning. It's lifelong, it never stops, it never changes, and you just continue. And I've been encouraged all the time, if I've wanted to do study, to go on and do further study. So that's how I kind of progressed it. So I did my orthopaedic course, and then I did modules that allowed me to initially become an emergency nurse practitioner.
Okay.
And then I was afforded to do some other studies that looked at different areas, which then I also allowed me to do some teaching within A&E. So I had a role that allowed me to be part of the practice development for just the department. And then as I've kind of progressed on, I was then encouraged to do my master's in Advanced Clinical Practitioner, and then onwards for an education certificate.
Oh, brilliant. So it sounds like not only were you passionate yourself, there was a lot of support from the organisation behind yourself, and that certainly pushed you in developing your career. In terms of, balancing that study with an active job as well, quite demanding job, nursing job, were you encouraged with perhaps time off? Were there certain stipends, fees that you were allocated, or how was, initially, how was that set up for you?
I have been very lucky in that virtually all my study, in fact all my study, has been funded. So the NHS England have all funded my education as I've gone. Study sometimes not. So there is a realism that sometimes you don't get all the study. So when I've done some of the modules at university, I've had to take some annual leave. But again, I've had a really supportive family behind me, which means that you can overcome stuff. So I've had a really good husband that, if I'd have said to him, you can be a stay-at-home dad, he would have done quite happily. So I've had good family support, because it's not easy. I don't want this to sound like it's plain sailing. There are massive peaks and troughs when you're working full-time, doing shifts, and study as well. It's huge.
Of course, that's one element that I didn't actually mention, but personal life, of course, for any career, that's ultimately what we're doing these things for, and family plays a massive role in that. So in terms of yourself, developing these extra skills, was that goal always to progress your career, or was interest mainly the main driving factor?
Initially, it was just to keep learning, progress my career. The people coming behind us quite quickly were the B2000s who came out with diplomas, and then people came out with advanced diplomas, and then so it was to keep up with the nurses coming through behind to a certain extent. I always felt I needed to be on a par with the people I was with. And as I became a senior sister and I managed people, or I had direct responsibility for them, I felt I needed to be at an educational level that they were at. And that was part of my drive for keep the study kind of going as I've moved on.
Yeah, because I can see from your CV here that the education that you've attained and the qualifications haven't been bunched around a particular time period. They've been throughout your career. And that's definitely interesting where you mentioned that you feel that, to keep up with developments, but also to keep up with your colleague base. That is something that you've definitely pursued. Yeah,
so I qualified in 91, and I think my first module that I did for something was in 1994.
Yeah.
And then I finished my last, because I have said I'll never write another word again, I finished my last kind of around about, 2020, 2021, something like that maybe.
Yeah, okay.
So that's a good 30 years of...
continuous learning and gaining qualifications. Yeah. So coming back to, incorporating, so that's academia in terms of you being a student. Obviously you've developed skills during this time of taking qualifications. incorporating every bump you've had in your career in terms of a progression to a higher band or a certain level of responsibility, the qualifications you've gained, have they sort of helped more, or is it the experience that you've actually got firsthand in the job that's perhaps helped you more, or is it been a combination of the two?
I would say it was a combination of the two. Definitely the combination of the two. So if I take when I progressed to be an ACP, so I had done 20 odd years in A&E by this point. I had watched doctors look after, treat patients for the past 20 plus years. I'd heard words, I'd seen things done. And then when it came to my ACP training, it was like, right, I need to consolidate all this information to do the ACP role, because I went the ACP role rather than matron and management.
Fine.
Partly because that doesn't meet my personality, and I just wanted to keep with the patients. So that gave me still a lot of patient contact. But I learned a lot of things within my ACP training that actually I thought I knew, but actually I didn't. And it was the education, it was that talking and learning from other clinicians from university that made me realise there was gaps in my knowledge on what I thought I knew from 20 plus years. So yes, I would say it's 50-50. I've needed both to get me to where I am now.
Yeah, of course, because bringing into your ACP career, so you've already mentioned that suiting your personality type in terms of progression within the NHS, there's two main roles, pathways that colleagues go through. Either they go through the management side, or they go through in terms of gaining additional responsibilities, gaining additional qualifications, and enables you to see patients in a different way perhaps. So making that you're quite a senior established nurse, and then you've decided to go into that ACP role. So for our students and our viewers that are watching at home, what kind of main things would you say were what pushed you towards that, or enabled you to have the confidence to say, yes, this is something I want to do for my career?
I'd kind of probably hit a point where in a junction where I'd been at a senior role, and like you say, there's the two decisions. Do I stay clinical, or do I go matron and management? And matron management, it's not my personality, it's not me at all. And without being too political, I think there's a limit to the change and the impact you can have. Doing some of that role. It's a lot of meetings for meetings, whereas actually going the ACP role, I could have an impact on a patient daily by my interaction with them, how I made them feel, were they comfortable, had they had a cup of tea, did they have a pillow, was I making good clinical judgments to make them safe and secure. So that was me, that was far more me. I could have an impact on a day-to-day basis by seeing my patients, and we all need to make that decision at some point, and that was ACP for me.
And it sounds like you made a sensible call based on your personality type and what you wanted to go do going forward. So when you first started your ACP journey, were there many ACPs at that time?
So there was none in A&E for us at Bradford.
I
suppose, again, politically, we knew that there was a drop in the specialities of people wanting to do A&E as a speciality. So the consultants made a bit of a decision that actually we need a permanent workforce. We need a reliable senior workforce that we help train and we trust. And so we were the first within A&E at Bradford. There were in other areas, but we were a group first in Bradford.
So tell me about your experience in terms of your training and, being recognised by patients, perhaps first time they ever heard of an ACP role. So if you can take us back to that time.
So it was that whole novice to expert, and I seem to have done it with my career the whole time. But I took myself back up. I'd had myself as an expert, senior nurse in A&E, and I took myself right back down to novice. So it really unnerved me. I did my training with 2 males, both over 6 foot. And the only reason I say that is because they would go into a patient and say, we would all do it, go into the patient and say, hi, I'm Liz, I'm a nurse practitioner, I'm an advanced nurse practitioner. Is it okay if I see you? Do your normal introductions for consent? And they would go, yeah, that's lovely. And then at some point they would say to me, is that okay, nurse? But they would get doctor, can I have? And I still think there is a discrimination against not discrimination, but there's definitely a variation in how the public see females in healthcare.
Okay.
I still think there's a perceived nurses are women and they do this, and men are doctors and they do that. I still think there is an element of that. So I struggled a little bit with that. I think there's, again, been peaks and troughs of people's appreciation of advanced practice. I have had patients say, no, I don't want to see you, I want to see a doctor.
Okay.
I did have one who said that, and then a few hours later said to me, what am I waiting for? And I did say, the doctor that you requested.
Yeah, so that does parallel with certain other professions within the NHS at the moment. We're seeing elements surrounding the physician associate background. And it's interesting you mentioned about the male-female dynamic, because I just have seen some recent research that for the first time in the UK, female doctors now outnumber male doctors. So I'm just wondering how long that time will be until it's expected that, you know, females clinicians are doctors or male clinicians are doctors, or, you know, whether that's a balance, because now, like I say, there's more with the research. I'm sure that we'll have the research in the chat as well, just to say that, yeah, that this is the case now in the UK.
Yeah, and I think it's coming. I think, you know, when they say that, you know, the weekend of International Women's Day, that we've broken the glass ceiling, we're on some ladders, rungs up to the glass ceiling. I don't think it's shattered yet at all. Okay. And I think it will be a little bit longer before that is fully kind of appreciated. So there's those kind of differences. There's obviously things that come into the press. Has something gone wrong that a nurse, an advanced practitioner has done, and that then puts the public on the back foot against advanced practice. You know, peers have the same thing. So there's that kind of, there's been those different challenges.
Yeah.
But as a nurse, and coming from a nursing background, medics look after each other a lot better than nurses look after each other to a certain extent. They are very supportive for helping you through if things have not quite gone as you had hoped.
Yeah, that's interesting that you mentioned that. You know, in terms of your own, when you're qualified to an ACP level, did you feel that your nursing colleagues still had your back in that way, or did you feel that there was a slight differentiation? Because you're not really part of the doctor's workforce, you're not really part of the nurse's workforce. How do you sort of bridge that gap?
So I've had multiple identity crises through my career. I'm worse than Dr. Jekyll and Mr. Hyde on how, you know, because initially, you know, how the nurses thought we were, when we first started, there was a little bit of, who do you think you are, you know, walking around with a stethoscope, you know, stethoscope around your neck. Well, it's around my neck because I can't get it in my pocket. So what else do you want me to do with it?
Okay.
So yeah, there was that a little bit, and you do feel very much initially that we were managed by nursing, but actually it was medics that we answered to a certain extent, because it was the patients that we were seeing and discharging. So yeah, there's been real mixture of how people have perceived you. Other specialities, you know, as a nurse practitioner, referring patients on to, you know, other specialities. Has your senior spoken to them? Has your senior reviewed the patient? Does your consultant know you're making this call? So there's been those kind of, and again, but that seems to peak and trough.
Yeah.
It's either very acceptance, or it feels that there is an element of people, who do you think you are?
Yeah.
So that, and it's a bit like, it's like all of it. It all peaks and troughs, it all gets better and goes off a bit and then gets better again.
I think some of the sentiments you've shared there would really reassure our audience in terms of someone maybe going through a tough time, thinking about their career, you know, facing that challenge where they're not quite sure which cohort they perhaps fit into. And thank you so much for sharing those thoughts from your career. I think we'll get into the crux of the talk now in terms of your, I think, pivot again, if you can call it that, into academia. So you mentioned that you've also had a stint working within the university, and I'd like to explore that a little bit, if that's okay. So we'll take it back again. So you're working as a ACP now?
Yeah.
And were you offered the opportunity, or did you seek an opportunity?
So I suppose in honesty, I'd kind of hit that 50 mark, and you know, we were still on nights, we were still on weekends. I'd always done some education, and a friend from another university, a local university, said, we've got a bit of a secondment, do you fancy it? And I thought, Yeah, I'll give it a go. I'll see how it is. So again, took myself back down to being a complete novice. So it was initially on a secondment for a couple of days just to see how it was. Again, I was at that crux of what do I do with my career? Where do I take it? I suppose it's an issue when you have a long career. You have many junctions. And it just took me into university world. There was also an element of I'm coming towards the end of my clinical career.
Yeah.
And, I feel I have a lot to pass on.
Yeah.
I have a lot to share. I've seen a lot of, and it was that as well, that wanting to give the next generation coming through
the benefit of your experience.
Some of the wisdom of the wise.
Yeah, absolutely. So, when you entered academia, what were the main differences compared to clinical life?
So I suppose the big one was the autonomy.
Okay.
I was a nurse. I was used to rocking up early for shift and saying good morning to the senior sister and, asking, being told when I could go for lunch and, checking on how long I was doing something. And it was the autonomy. It was really difficult for me at first. And I felt like I needed to tell somebody where I was all the time.
Okay.
But it's very much, that change into this is your workload, you manage it in the time that you're allotted, here you go. So initially it was the autonomy, that freedom of how my work and how I worked felt very strange. I was used to being told to turn up here, do my shift, do what I needed to do and go home again. So initially it was the autonomy. And then there's also that little bit of imposter syndrome. Should I really be here? Am I really an academic? Because when you think academic, you think highbrow, research, don't you? And double-blind tested and all that kind of stuff. And actually, it's not all that, particularly when it's a vocational look that you're doing. So whether it's undergraduate nursing or whether it's the postgraduate advanced practice stuff, it's not that. It's about you passing on the knowledge you've got. So it was the autonomy and the imposter syndrome that initially I struggled with.
And how long do you think it took for you to develop your teaching skills? Because I'm sure you'll agree, you can be a fantastic clinician, you can be doing well in your career, but to teach someone who's perhaps at the start of their career, then a different frame of mind, much younger, have different lifestyle goals, is it easy to make that transition from actually practicing to teaching it?
I think when it was subjects I was very comfortable with, particularly the undergraduates, if I was doing the acute care module and they were asking me about how you nurse trauma patients, that was all kind of more comfortable. I think some of the biggest challenges I've faced about teaching styles is with the postgraduate ACPs, when you're talking multi-professionals. So whether they're all registered practitioners and you've got pharmacists and paramedics and occupational therapists and nurses and we are all very different. Our core personalities that make us that are very, very different, and it was adapting to teach those varying professionals that initially I struggled with a little bit.
Yeah, because as you mentioned, if you're teaching advanced practice, some of your audience may be a physiotherapist who may be really hot on anatomy, and then you've got a pharmacist who's really hot on pharmacology, and perhaps there's little overlap between the two disciplines. So it can be quite challenging teaching a cohort like that.
Yeah, and that's taken some adapting. And I think with most things, the other bit of worldly, our wisdom that I will pass on is don't expect things to be perfect within a few weeks or months. You usually need to give places a while for you to settle into them. I would often say to new starters in A&E, give yourself 2 years to be comfortable. And I would say that about academia. Don't expect in the first term that you're going to be really comfortable and this is all, because it's a very different environment. Give yourself time to settle in and do it at your pace. And be guided that way. That's
really, really insightful, and I'm sure our audience appreciates that. Just quick one, if you had to say one over the other, it's a difficult one to say, but do you think clinical placements have a higher role in terms of rounding off a clinician, or the textbook and the knowledge-based stuff that we do? What do you think has, for your experience?
I think you need both. When it's a clinical job you're going to be doing, when you're doing a practical job, you do need both. I think the workforce within the NHS is going to change hugely, and I think within universities, undergraduate wise, we have to learn to move with what's going to kind of come out. You know, it's a bit like sitting on the roundabout, it goes round. You know, we used to have registered nurses and enrolled nurses, and now we will have registered nurses and nursing associates. So the workforce is going to change massively. So I do think you need both, and I do think it's important that you have a reasonable amount of theory, because you need to make a judgment.
Yeah.
You need to be able to say why you're not doing something.
Of course, yeah.
So if you have the right theory, you can say, I'm not doing this. I know this is the normal pathway. I'm going to deviate from it because of this. So I think you need both, because the bottom line is patients still just want us to be able to care for them and communicate with them.
That's a really, really valid point, and I think I'll accept that as an answer, although you didn't pick it one way or the other.
I'm not committed, because you're asking an old nurse. So as an old nurse, I'm going to say clinical, far outdoes.
Yeah.
But being politically correct, I know that it's going to change, and obviously, I would say personally, you need good clinical experience.
Yeah.
You need that time with the patient. You need that time with people in vulnerable situations to hold the hand, look them in the eye, and tell them it's going to be okay.
Yeah, most definitely. I think I would agree with that as well. Point that probably a lot of our audience would like to know. What are your top tips? You've already mentioned a few, such as, you know, giving it any new work, any new job time to establish yourself, to settle in. But what are some other top tips you would impart onto our audience who are looking at switching over to academia, making that, you know, we're not talking about research, we're talking about academia. So someone that's trying to pivot into that role, what top tips do you have?
So I think the secondment and doing it part-time initially was really good for me. So I stayed part-time clinical and part-time academic. I did that because I felt it still gave me some validation on me teaching. So that's why I kind of stayed with both. It kind of fed into the other quite nicely then. So it kept me up. The academia kept me updated for my clinical practice, and the clinical practice stuff kept me updated for what I was doing in academia. So if you're thinking about having a go, maybe do something part-time initially.
That's a good tip.
Maybe look for a secondment so that you still keep your contract with where you are, so that you're not committing fully to see whether you like it. You don't know until you're stood in front of, if it's undergraduate, 400 students, or postgraduate, you know, a mixture of professionals, how you're really going to feel until you do it.
Just to interrupt there slightly, for those who don't know, what is a secondment?
So a secondment is when so the university I went to work for paid my work for me to go 2 days a week.
Okay.
So I still had a full-time contract with my clinical place, but the university paid the trust for me to be allowed to be freed up for 2 days.
Okay, making sense, yeah.
So that's a secondment. So one company will pay the other company for you to go work for them.
I suppose the alternative would be just to reduce your hours on clinical and then just pick up a part. That's an alternative way.
That's an alternative way you could do it. Yeah.
Okay. So any last tip that you'd say? So you've mentioned ease yourself into it, take some time, and perhaps pursue part-time hours. Anything else?
No, I think those are probably the main ones, really. Just give it a go and see.
I notice on your CV that you've mentioned you've got some teaching qualifications as well, such as a PG certificate, postgraduate certificate in education. Tell me a little bit about that experience. Was that a key foundational step for you to step into academia, or do you feel it was a bonus? Or
so I think it's back to that. It gave me some theory behind what I was doing. So it gave me the words, the pedagogical words that you could use to be able to sell something that you were doing. So it gave me the theory behind probably what I was doing. So it kind of helped support. And actually, it did make me change some of my lectures to do different ways, flip classrooms, doing other things. So actually, it was useful. It was the thing that I said I would never write another word ever again after that. But it was the final straw. But it was, again, it's a bit like all the education. You learn something from it each time you do something.
So the famous chicken and egg situation. So you started academia and then you pursued the further qualification. Yeah. But I think a lot of places now actually request you to have some kind of formal education before pursuing a teaching role. So is it something that you felt that was worthwhile to your clinical practice?
Yes.
Yeah. So simple answer, yes. It's worthwhile getting a formal education in teaching, and that would not only help with your theory, but also make you stick out amongst candidates. That's really good. In terms of yourself, you've had a long career in the NHS and now in academia as well. I suppose it's under the wider umbrella of healthcare itself. And do you feel that academia will now be your job for life? Do you see any more pivots to your career? Is there anything else that you want to do, perhaps abroad, anything else?
No more pivots, no more anything else. I've hit my point of I'm just ready to offload all my knowledge to other people so I can rest off into the sunset.
And do you think it's quite a fulfilling career in terms of being in academia? And there's challenges, of course, within the current climate with universities, cutbacks in terms of staffing, services available. Is it still that fulfilling career that, how many years ago did you sign up?
For nursing?
For academia.
So I started in academia in 2018.
Okay, and still, would you say it's still giving that fulfilling role?
Yeah, it's that penny drop moment. It's being able to explain something to somebody in a way that they suddenly go, oh yeah, that's amazing. I now understand it. And that gives me the same buzz as it did when I was with Ethel, making her a cup of tea and giving her a pillow and making her comfy, and she'd go, oh, thanks for that. They give me the same kind of buzz and drive to kind of keep going. Yeah,
I mean, that's really insightful that, you know, towards the end of your career, that with all the experience you've gathered, you're now sharing that onto students and hopefully inspiring the next generation to develop their own skills in that way. One of the questions I did want to ask you is in terms of your academic work in working with a wide variety of different professionals. There are some professions and some students that perhaps have not had the same amount of patient-facing contact. Is there a particular challenge that this brings to your academic work in terms of mentoring them and teaching them? Is there anything that you would give, for example, for tips, how to bring them up to speed to their peers and colleagues?
So yeah, there is definite variations between, say you have a nurse. So we've been used to, you know, very much being very up close and personal with patients from year dot, compared to maybe pharmacists who could be more front facing. So they wouldn't have that same patient contact. But what we've found is, so there is a variation, and it has taken a little while to kind of get used to it, but definitely using interprofessional teaching has a massive bonus. So when it comes to that, without stereotyping pharmacists too much, they are very kind of black and white and a pathway. Whereas nurses, we might be a bit more vague about what we're doing, or as long as we've got a bit of a tick box, we'll go with it. Being able to get them to work together. So the nurses can help support the pharmacist with that touchy-feely, getting up close, getting personal kind of response. Yeah. You know, it's even down to, you know, if you auscultate a chest, the difference between me and you, somebody auscultating our chest is very different. They're going to be far more comfortable with you than me.
Yeah, of course.
Because of extra bits. And it's kind of getting used to that. Whereas getting the interprofessional education going, the nurses will support the pharmacists or any other profession on that. Then you might come to your non-medical prescribing. Nurses don't do any pharmacology. Ask us to start doing maths and we're like, no, it's not happening. Whereas the pharmacists, that's them. They do pharmacology. So what we've worked out is you get them to support each other.
Okay, so that's a help rather than a hindrance.
Yeah, so getting them to be together and work in groups together has definitely been a massive bonus. You know, if you get paramedics in there, they'll add something else in. Yeah. And we are personality types. There's definitely something about what makes us a nurse and them a paramedic. Yeah. So getting us all to do something together has definitely been a way forward. So rather than shying away from it, It's actually admitting it, admitting those bias, admitting those stereotypes, and working with them.
So in your clinical practice, do you ever see any cliques forming, or do you not really go down that route?
No, we happily welcomed a paramedic, we let him in.
Yeah, perfect. Brilliant. So thanks very much. It's a very insightful talk that I've had with you today, Liz, and I'm sure our audience as well will have loved the insights in terms of progressing your career from yourself in nursing, but whatever background you're from, developing that, progressing into higher roles with perhaps more responsibilities, and then progressing that into academia as well. So if you're interested in Liz's journey, I'm sure that these insights can definitely be incorporated into your own career pathway, and that way you can excel as well. So I'd like to wrap up there. Thank you very much, Liz, for her time, and thank you for the viewers as well. We'll catch you on the next podcast with another interesting conversation in terms of careers and hopefully more tips for your applications and your development as well. So catch you around, guys, and thank you very much.